around the state. And really, it has been an extraordinary display of corporate social responsibility and generosity, community development, and of course our Colorado collaborative spirit. All the masks have gone to vulnerable populations and essential workforce in high risk of exposure and with limited access to protective equipment. And I want to note that businesses, organizations, and individuals for whom cloth masks are the cost of doing business are strongly encouraged to purchase these masks for their employees. And we do have a list of low-cost providers, and it can be found at the ColoradoMaskProject.com. And again, for businesses and organizations to purchase these masks, you can get them at ColoradoMaskProject.com. Next slide, please. Okay, so right now, over 82,000 masks have been delivered, and we're in the process of delivery to about 162 recipient organizations. We expect to deliver an additional 16,000 masks, so total delivery will be about 100,000 masks to over 200 recipients. And I want to note that these recipients span 42 counties across all parts of Colorado and include nonprofit and community partners such as homeless shelters and rescue missions, assisted living centers, elderly care, mental health and nursing homes, domestic violence safe houses, immigrant and refugee centers, and so many other community organizations. And really, the depth of the program spans all phases of production and distribution, from design to manufacturing to transportation logistics. I just want to mention a couple of the really great volunteer companies we've been working with, everyone from Peak Beverage, Alliance Moving, Lux Holdings, Hunter Douglas, Topo Design, Pearl Izumi, Pushkin Wear, Denver Mattress, Temper Sealy, Osprey, Eco Enclosed, Fashion Design Center, Melanzana. I know I've missed a few, but just a really, again, a great private sector participation, as well as individual sewers and maker communities such as Masks Now around the state. And really, these groups estimate that they've provided over 200,000 additional homemade and donated masks for communities around the state. And again, you can get more information on the ColoradoMaskProject.com. Next slide, please. Look at these, aren't they terrific? I also want to talk about OEDIT's Creative Industries Office. We conducted an online mask design program competition several weeks ago for kids around the state, and we had over 1,200 submissions were entered into the competition. We had children as young as 5 and 6 years old making these designs, and as you can see here, they're just really fabulous and creative. And you can find samples of these masks at ColoradoCreativeIndustries.org. And again, that's ColoradoCreativeIndustries.org. And the success and really the selflessness of these efforts are really inspirational. But ongoing projects and significant demands remain. So again, we encourage companies with the ability to donate masks, those with cut and sew capabilities across the state, or individuals who can just sew in their own home, to contact the Colorado Mask Project. Again, ColoradoMaskProject.com. Okay, next slide, please. At this point, I want to talk a little bit about the Colorado COVID-19 Business Survey. In addition to serving the public health needs of our community, at OEDIT, we're also actively engaged in identifying the economic needs of Colorado's business community. And to this end, we have worked together with Downtown Colorado, Inc., which is a statewide nonprofit, and also Polco, which is a engagement and polling platform platform to create a survey that would reach as many of our businesses as possible as we try to understand the magnitude of the situation that they're facing and the resources that they need right now. As you can say, loss of sales is staggering. Layoffs is at 23%, and anticipating potentially having to lay off over more than 50% of their employees during this crisis. We want to thank all of those who participated in the survey, and sort of some of the main takeaways are really that businesses need liquidity now. Businesses are holding on for a relatively quick recovery. We know that they can hang on for another 1 to 6 months, but after that it's going to continue to get very difficult. Most respondents feel they're pretty well informed about relief programs, and many of them, I'm happy to say, have been able to take advantage of federal programs. Next slide, please. One of the things, again, that our office has been particularly focused on, because as you see, grants and renewed access to customers and income tax relief are all very important for our businesses. We've been focused on making sure that Colorado gets its fair share of the stimulus, really unprecedented stimulus money coming out of Washington, paycheck protection, economic injury disaster loan programs. But we've also created a COVID-19 Business Recovery Center. You can find that at choosecolorado.com, where we also have a page listed to, in addition to the federal resources, well over 100 alternative sources of funding that are available to businesses in the state, public, private, foundation support, local community support as well. So we're continuing to update that. As just one example of something an additional we have done is our office has been partnering with the Gates Family Foundation and other philanthropic organizations to raise $26 million in liquidity for nonprofit lenders. And they're using this to fund PPP loans for small businesses that were not able to find funding through larger banks. We are also continuing to identify recommendations through our Council on Economic Stabilization and Growth. We know that there are businesses who are unable to take advantage of the federal programs, and we are designing some relief packages over the next couple of weeks and months to make sure that all of our Colorado businesses, small minority-owned businesses, get the support that they need during this very difficult time. Next slide, please. So that is my brief presentation. And Mariah, did you say, are we going to take questions now or after Kevin's presentation?
We're going to move right into Q&A now.
Right.
So, okay. And just to reiterate and just remind, so we have Betsy Markey, Executive Director of Office of Economic Development and International Trade, to answer questions about what we just discussed in this presentation, and then OEDIT's COVID-19 response. And then also Kevin Klein, Director of the Division of Homeland Security and Emergency Management, who can answer questions about the State Emergency Operations Center response. Okay, and then to ask your question, just raise your hand. So I'm going to stop sharing my screen here. And all right, so I see Sam Tavachnik. You are unmuted. Go ahead and ask your question.
Right, thank you so much. So yesterday, the state announced that the Colorado Convention Center in Denver will now be ready in June, which is about 6 weeks after it was initially scheduled to open. I know that state officials have talked about the state hasn't needed it because the surge has not really happened, that hospitals have been able to handle their capacity. At what point does this keep getting pushed back to the point that it just gets turned back into its previous space and it goes back to being a convention center?
Sam, Kevin Klein, thank you for that question. You know, we're looking at the data every day, and we're looking at what our hospital capacity is, and we are adjusting the dates as necessary. So what we don't want to do is put additional cost in by staffing and by staffing those facilities. And we will keep, looking at what the data tell us and what our hospital capacity is, and we'll adjust, until at some point in time we'll make a decision as to what that capacity is, what we're able to sustain, and get it back to being a convention center. But for the time being, we're going to adjust our dates based on our projected needs and the projected needs of the healthcare community.
Ellis Arnold, I have you on the line.
Hey, can you guys hear me all right?
Yes.
All right, wonderful. Yeah, I just wanted to check before I ask. Are you guys taking questions about testing today?
Testing questions would be best directed to the media info box.
Okay, sure. All right, I'll do that. Thanks.
Serena Ung, I have you on the line.
Yes.
Serena, try again. I think you're unmuted now.
Oh, can you hear me now?
Yes, we can hear you now. Sorry about
Okay,
that.
great. Just wondering if you are aware of any efforts by nursing homes to seek liability protections from lawsuits, and if so, do you believe such liability protection is appropriate or warranted?
Serena, I think that's another question that's probably best sent to the media_info box. Thank you. Okay, next on the line, I've got Taylor Summers.
Hi, yes. This is a question for Betsy. You were talking about the process that a lot of small businesses are going through still to try to get these PPP loans. I was wondering if you could give me kind of an idea of how many of these small businesses here are still trying to obtain these loans as we're going potentially through another phase of the CARES Act, and what sort of things you would like to see going forward to make sure every business can get at least some help here to stay afloat.
Right. Thank you. Great question, Taylor. So, the first round of PPP, which is, $349 billion, about 48,000 Colorado businesses received that money. Right now, we're well over 90,000 businesses have received. I think we're up to about 10 or 11 billion. There's still a little bit of money left in the second tranche, but we know that 98% of the businesses in Colorado are considered small businesses. So there's a lot of people who have not yet been able to access that. We would really are advocating for some additional funding, because we know our small businesses are the ones that really keep our economy running. We also, and I know the governor has advocated this to the federal delegation, to extend the amount of time. Right now, these are forgivable loans for 8 weeks of payroll, and we think that time period should be lengthened as well. So again, more time for businesses to be able to use these loans, and really to make sure that we're covering everyone. Additional tranche of funding is necessary as well.
Thank you.
Mm-hmm.
And everyone, if you would, when you ask your question, just please say what media outlet or publication you're with. Thank you. Chris Vanderveen, I have you on the line.
Hi, Betsy. I just want to get a quick idea. This is Chris Vanderveen with 9 News. I just want to get a better idea of the methodology behind the business survey. How many businesses responded? What was the time frame in which the survey was conducted? Just a better idea of the methodology behind it.
Right. We'll have to get back with you with the exact number of businesses that we, so that I don't give you the wrong number. But again, we worked with the polling company. The methodology was to find out, so we were really, the gist of it is where are the pain points? What kind of layoffs are you seeing? How are you responding? What additional support do you need? But we're happy I'm happy to, we're still, to be honest with you, we're still compiling all the results of the business survey. And I haven't seen all of the final recommendations. These were some of the top line results that we have found, but we're certainly happy to get back with you with some additional information. You know, I will say this is not part of this particular survey, but there was another survey that was completed, and I received it through the Denver Metro Chamber, that in terms of the number of businesses that are applying for unemployment insurance, Colorado has one of the lowest rates in terms of the percentage of our workforce applying for unemployment insurance. So, you know, while so many businesses across the state, this is incredibly difficult and painful compared to the rest of the country, you know, because of the diversity of our economy, we are able to have, at least compared to our peer states, a fewer number of businesses where employees are applying for unemployment insurance. Just another data point I wanted to share with you.
Next on the line, I have Charles Ashby.
Yeah, Betsy, Charles Ashby from the Grand Junction Daily Sentinel. I haven't seen the survey, so forgive this question, I don't know. But I'm wondering how many businesses, maybe through the survey or just in general, have asked your office about, you know, tax credit programs, whether they should be continued, worried about some of them getting cut. Obviously, you're aware of the Jumpstart program issue with the bill for the legislature. Are you getting any sense of those kind of programs, those kind of, you know, enterprise zone programs, and what's going to happen with those going forward?
You know, we have had a very robust process through the Governor's Council on Economic Stabilization and Growth. We have, at this point, we've got close to 200 people, both state employees and private sector people across the state of Colorado, making recommendations on how to move our economy forward. We're compiling all of those recommendations right now. They include things that we're looking at we like the federal government to do, some issues that the state legislature potentially could take up, and other things that the governor can do via executive order or administrative action. There is concern about tax credit, but at the end of the day, we are in a very, very difficult position right now with as every state in the country, I think with the exception of Vermont, has to have a balanced budget. And with a several $billion-dollar shortfall right now in the state's budget, I know that every agency is going to be asked to do their part and find cuts in their budget that are quite frankly going to be very painful. Here at OEDIT, we're just making sure that we are using all the tools that we have available, which we know have a positive return on investment for the state in terms of jobs created and economic activity, and we can continue to use those tools to our greatest extent.
Thanks, Betsy.
You bet.
Next, I have Sadie on the line.
Hi, this is Sadie with the Fort Collins Coloradoan. I was just wondering if there is an update on the opening of the alternative care site at the ranch in Loveland. I think last we heard it was opening May 15th with 195 beds, and I wanted to see if that was still accurate.
Sadie, we've pushed that back. It's Kevin Klein, and right now we're looking at June 11th to be in a position to go live. Again, opening is going to depend on demand. So we are going to be, evaluating what we need, but that is right now our target to be able to open it. And I say that with the understanding that if there's no demand, we're not going to be paying to staff it. So June 11th for the ranch and June 4th for the convention center are our target dates, and we will evaluate whether we need them or not. But our target is to have them ready to go if we need them. we don't want to pay for staffing them if we're not going to use them. So we're going to be being judicious with our use, and we're hoping that we can continue to flatten the curve so we don't overwhelm the hospital system and need to use them.
Erin O'Toole, I have you on the line.
Hi, this is Erin O'Toole from KUNC in Northern Colorado. And this question is for Betsy. Just wondering, I know there's been confusion among small businesses about, how the process works for getting these loans and grants. Just wondering if your office is doing any outreach to small businesses.
Oh, thank you for asking that question, Erin. Yes, we have been extremely involved. I'll tell you, our office oversees 15 small business development centers across Colorado and all regions of Colorado. We have over 300 certified, through those SBDCs, we call them, over 300 certified business consultants. These are people who have, former business, current business owners, pretty much volunteering their time to help thousands of businesses through this process. So that's been really invaluable, that people are able to work one-on-one if they're having problems with their bank. We have a list of other banks that we know that we can refer them to. We've had a really robust relationship with all the independent banks, the small banks, the nonprofit lenders throughout the state, who are also working to help people through this process. In addition, we are operating a hotline, and I can give you that hotline number. It's 303-860-5881. And we have many of our staff here at OED detailed to our hotline. We have a lot of our SBDC consultants on it as well. So individual business owners can call our hotline, let us know their issue or concern with getting some of these federal monies, and we personally walk them through that process. So it's been, I know we've gotten so many emails from people who are very grateful that they get to talk to a live person to, again, walk them through this process. And we're continuing with that. And as we move forward, I know there's a lot of questions regarding compliance and actually what part of my loan is forgivable. So we're going to be continuing those robust efforts through the next phase. Now, if people have this money, how do they comply with the federal regulations?
Thank you.
Mm-hmm.
Sam Tabachnik, I have you on the line.
Thank you. Sam Tabachnik with the Denver Post. The governor talked yesterday about touting some of the PPE supplies that the state has been able to get since the beginning of April. I wanted to ask about the supply chain right now. I know that it has been a topic of discussion and consternation amongst government officials having to fight against other states and even the federal government, other countries. What is the supply chain like right now? Is the competition slightly less so? Has domestic production ramped up enough that the supply chain is able to keep up a little bit now?
Sam, Kevin Klein here. It's still a challenge. So we still have some challenges getting some of the supplies in. We're still in crisis standards of care use of PPE. We still are reusing, but we've put in some methods like the battle system, which you can sterilize the N95 mask and reuse them. We are trying to be judicious in making sure that the healthcare providers, first responders, through a priority process, get PPE. We are starting to see things like additional surgical masks come in. We're starting to get a supply of those. Because we're dealing with vendors that we haven't dealt with before, we actually test the supplies before we send them out to be used by healthcare workers to make sure they meet the standards. So we've got some more surgical masks that we're testing right now. We've got some N95 masks that are coming in. We are starting to explore long-term purchasing agreements with manufacturers and looking at a sustainable system to get PPE in on a regular basis as we move forward. So I think that's a sign that some of the manufacturers are getting their supplies and their manufacturing processes ramped up. So we see some of that coming online. We're seeing some of the manufacturing for gloves that we're starting to pick up on, and we're still challenged with gowns. We're starting to see some of that though come in. So I think the bottom line on your question is that it is still a challenge, but we are seeing some additional capacity that we're starting to take advantage of.
All right, Chris Vanderveen, I have you on. Hang on just a moment. You should be on the line now and able to speak.
Thanks, Chris Vanderveen with 9 News. Kevin, this is a question for you. I am curious. One, do you have an anticipation of how many beds you'll have at the ranch? Has that decreased? And then two, barring anything unforeseen, if you don't have a dramatic uptick in patient load in the state of Colorado, it doesn't appear as if you're likely to start utilizing either of those facilities in June. Do you have a plan, and what's your plan for keeping those facilities essentially on standby? And how long would you be willing to keep those facilities on standby in maybe in anticipation of a second wave, for example?
Chris, your first question, the answer is that we are now shooting for 200 beds at the ranch complex and 250 at the convention center, sorry. So those are the numbers that we're shooting for now. Obviously, the space that we have, we can scale that up, and we have built that into the infrastructure there if necessary. I think that your observation on a second wave is what we are, planning on being able to utilize, and that would be into the fall. So, again, we're planning for the worst, hoping for the best. We hope that our social distancing policies, we hope that safer at home, we hope those, with businesses in the mass project and all these other things, keep that curve flat enough so we don't need to use it. That would be ideal. But we want to keep the ability to turn them on in short order through what would be the next wave in the fall. So we will watch the numbers. We will keep in touch with the epidemiological data, with the hospital utilization data, and make the determination based on those data. But it really comes down to making sure that we're ready if we need it. And we have it in basically a warm status, so we don't have the staff, but we've got the staffing contracts, and we will turn that on at the appropriate time. But really looking to the fall before we reevaluate what we want to do with them.
Next, we have Ellis Arnold. You are unmuted.
Hi, yeah, this is Ellis Arnold with Colorado Community Media. This is a kind of a follow-up question for Kevin. Going off of talking about the second wave possibly happening in the fall, does your division or your office, have you guys seen models on when a second peak might come? Based on restrictions being lifted right now, is that expected to happen in the fall? And how will that second peak compare to the first?
But So we're hoping it will be less than the first, but we again are planning that in case it isn't, that we are able to meet the additional demand. In that model is really what the governor presented earlier, and it's on the website, so you can look at the modeling there. The charts are all on our website. So it is in the fall when we see that second peak.
Any other questions? All right, I'm not seeing anyone else raising any hands, so if you have questions, you would be first in line. Okay, well, we do thank you all for joining us here for this remote media availability with this new format. We really hope that you liked it, and as the response evolves, we'll do our best to keep getting you subject matter experts from different agencies and organizations that can help to answer your questions. So again, we thank you very much for joining us, and we'll talk to you next time. Thank you.